Elevation Health, friends and family. We've got some things to discuss today. Very important. The three major factors affecting your heart health. We know it's that time of year where we focus on heart health, and there's a reason why, because every 33 seconds a life is lost to cardiovascular disease. And most of this is preventable. So for many of you watching this, it's a good amount of people that that you and I know and love, and again, most of it's preventable. So before I get into that, I want to wish a very special happy birthday for a few people here for the month of March: Evelyn Ruiz Arnold, Lane Wildis, Lynn Freed, Daniela Camargo, Jessica Gantz, Rudy Brown, Debbie Hevia, Romulo Della Piccola, Trevor Ward, Suhaila Ramlal, Gary Mulak, Nina Midkiff, Bruce Landry, Jim Hamilton, Vianney Francis, Edgar Compress, and Maddie Smith. I want to wish each and every one of you a wonderful happy birthday. May this year be your healthiest year ever. We love and appreciate you so much. These are our birthdays for the month of March. And so on to our topic today. And again, we're talking about the three major factors that are affecting your heart health as we move toward our Healthy Heart Masterclass. It's coming up next week. So one of the things that I usually bring up when I do these video segments is a lot of the conversations that I have with some of you as my patients, the questions that come in, the concerns, and that's really what formulates what I discuss here. So as I bring this up, realize that I'm answering many of your questions, some of you that have asked me, but many of you in advance, as far as your heart health, what your cardiologist recommends, what you've seen on TV, what your friends and family are doing or telling you to do. First, obviously, regarding cholesterol medications. And I know that many of you watching right now are taking cholesterol medications. And I'm not going to tell you to stop taking medications. Everybody's different. Your health profile is different. What you do for your health is different. So in some cases, it's a necessary evil until you get your lifestyle modifications underway. However, long term, there are some risks that you need to be aware of. If you're not aware of it, statin medications increase your risk of death. Cholesterol medications increase your risk of death. A publication called the American Journal of Cardiology published this. Researchers followed nearly 300 adults diagnosed with heart failure for an average of 3 years, and in some cases up to 11 years. And what they found was those who were taking statin drugs, who had the lowest cholesterol, were found to have the highest rates of mortality. And then conversely, on the other hand, they found that the people with the higher levels of cholesterol had a lower risk of death. Why is that? Well, if that's important to you, make sure that you don't miss the upcoming Heart Health Masterclass. And so we're going to unearth and unpack and get into exactly the reasons for this to boost your confidence and help you make better informed decisions now and in the future for you and your family. If you didn't know this, also cholesterol medications, while they seemingly serve one purpose, at the same time, they're depleting your body of something called CoQ10. And that's the reason why many cardiologists tell you you have to take a CoQ10 supplement, because it gets depleted when you take cholesterol medications, which CoQ10 is an essential mitochondrial nutrient that facilitates energy production in the heart, in the cells, in all cells. It's an essential nutrient which gets stripped out. It also, cholesterol medications inhibit the production of vitamin K2, which actually protects your arteries from calcification. So if you lose that protection for calcification, preventing calcification of your arteries, guess what happens? You're increasing your risk of coronary artery disease. So the very reason for the prescription of this turns out to be part of the problem. And so something to be considered. Again, we'll talk more about this at the masterclass event. Another factor is too much sugar. What does sugar have to do with heart disease? Well, sugar causes inflammation, and it has more to do with metabolic disease. And then also sugar molecules attach themselves to cholesterol. And that's what causes the inflammation of the lining of the blood vessels, almost like a Brillo pad inside your blood vessels. And that's what increases your risk of heart disease. Again, this is why the masterclass is so important. These things just fly right over our head, right over the radar. We're just not even aware of it. How to correct these problems if you're looking to reduce and get off of some of these prescription drugs, which are harmful in the long term in the absence of lifestyle modification. Like I said, 80 to 90% of these issues, disease-related issues with the heart, are preventable, treatable, and curable with proper lifestyle. And here's one of the worst things: a low-fat diet. Yeah, we were told to have that many decades ago, and look where it's gotten us. Not less cases of heart disease, more. So you need good, healthy fats, reducing your fat intake, good, healthy monounsaturated fats, saturated fats, you absolutely increase your risk of heart disease. And studies show there's no reduction in death rates at all, or heart attack or stroke, by reducing fat intake. So where do you go from here? How do you make application for this? Well, I encourage you, strongly encourage you, to make the time, block this off in your schedule to join us at this masterclass event. It's coming up a week from today. That's next Tuesday, March 10th at 5:30 in the evening. And at this event, you're going to discover the hidden, insidious thieves of health. What is robbing you of your health? These little things that fly under the radar, that lie in your pantry, your medicine chest, and your head. Yeah. So I'm going to show you exactly what to do to correct it, so you can avoid needless crisis visits to the doctor, hospitals, anxiety, stress. Show you how to, avoid drugs and surgery if at all possible. And we've been so successful with this. We've had a great track record with this with our patients who take this knowledge and actually apply it. So you can get all the answers to all this, as well as how to reduce your risk of heart disease, get better control of your blood pressure and your cholesterol, reverse type 2 diabetes, learn about the most heart healthy nutritional strategies. So again, this is coming up here Tuesday, March 10th at 5:30. Make sure that you get your name on the registration list. We're almost out of seats. So if you're in the office now, stop by the front desk, make sure that your name is on the registration list for you, guests, family, friends, loved ones, whoever it is. Make sure you register now. If you're not in the office, call the number 954-472-6002. If it's on the banner below. We look forward to seeing you there. Thank you so much for joining me today. I love and appreciate you. God bless.